Thank you so much for joining me on the way forward. It is great to have you. And it is great to have this man on the way forward, Dr. Lance Lamotte. He is a cardiologist. Full disclosure, he is my cousin. And he is someone who a few weeks ago had him on the Good Morning Show just to talk about how we can take care of ourselves, especially after Mardi Gras. And I know people are thinking to themselves, oh, Mardi Gras was so long ago. But there's something that he said during that interview that I had not thought about. I'm not going to steal his thunder. So let's just start off by talking about the actual problem, Lance. And I, when I originally wrote this question, I wrote it about heart disease being one of the leading causes of death, but it's a leading cause of death still, according to the Center
It
for
is.
Disease Control, and so I think the stat is like 1 out of 5 something like 1 out of 5 deaths is a heart disease death in the nation.
Yeah, it's there's no shortage of work for us, particularly here in our home state. So yeah, heart disease is the number one killer. It outstrips cancer, respiratory diseases, COVID, all that combined. And so just the estimates are that there are 130 million people just in the U.S. alone with some form of heart disease. And, that's a broad, blanket term, but I mean, there's a tremendous prevalence of disease, and particularly here in the South, we are burdened with it at a much higher rate than many other parts of the country, simply because, I mean, people enjoy the cuisine and the culture here in the South, but we pay a price with our health and our longevity many times. And so, yes, it's a big problem.
So one of the things that you said during that interview that I had never thought about, it was honestly a bit shocking to me when I put it together. I, positioned it as taking care of ourselves after Mardi Gras. But you said that the strain that we put on our hearts actually starts way before that, especially in Louisiana. And you started with Thanksgiving.
Yeah. Well, you think about it, how we that see this whole season that we're frankly still in, that stretch when we get together to celebrate Thanksgiving with our loved ones, and that's a time of excess. We sit down, we eat heavily, but we know in New Orleans in particular, that Saturday after Thanksgiving is the Bayou Classic, so we have that, and there's a lot of camaraderie and things going on, and that is followed in the next month. There's Christmas, and those of us who are working, and many times there are Christmas parties, weekend after weekend after weekend leading up to Christmas, and then you're eating leftovers, and then you got New Year's revelry, and people. So it's really nonstop. And then another thing that's unique with our culture is, king cake season then starts, right? So we can't wait to get our mouths on that first slice of Antoine's or Randazza's or Dong Fong king cake. And then if you get a baby, you got to get another king cake. And so there's, right. So that's just unique to us. And then, we're big into sports here. So you've got playoffs. You got college football playoffs. You got NFL playoffs, and then the Super Bowl. We have Super Bowl parties, and Mardi Gras is usually right around there. So, yes, we talk about some of the excesses with alcohol and excess food consumption. That's not just unique to Mardi Gras. And so, our this season in which we end the year and begin the next year is often a season of excess. And I've seen people who come, let's say 6 month intervals, and I'm looking at their demographics, their vital statistics, and many times the weight will be up in the winter months, just because of the habits that we are used to here. So yes, that's a big deal. And so we recognize that these excesses, alcohol can raise blood pressure, can cause uh, some other health related issues. Fatty foods in general can lead to, in the long term, regular consumption of this stuff can lead to the development of risk factors that can put you at risk for developing coronary events and stroke, et cetera. And acutely, a big, rich, heavy meal can actually make the blood a little more sticky And so, there's actually a little bit of risk just from sitting down eating, too much of this stuff at one time.
Wow. And then um, to think about what happens during Thanksgiving, particularly when people are posting pictures of their plates on social media, and it almost turns into a challenge for some people. I mean, there's some people who are thinking to themselves, all right, I'm going to get over to my cousin's house and I'm going to load the plate up and I got to finish every single
Yeah.
morsel that is on that plate. Then I got to show the empty plate on social media after that. So there's some peer pressure, it seems like to me.
Yeah, and I mean, and, you've seen me when in back in the day, I would stack my plate as well, and then we would all be laid out on the sofa
Yeah.
an hour later, fighting for sofa space to sleep. And so, yeah, I mean, that's
Yeah.
it's just that. But you think about it, we do that. I mean, on those special occasions and get-togethers. But there are some people where that's a weekly deal. I mean, families get together on Sundays after church, and some people really eat these really rich and heavy foods on a regular basis, and it takes a toll. It does take a toll on our individual families, on our communities in general. So we just have to have an awareness of the risk that is associated with those types of habits.
Hmm. What about the prevalence of heart disease throughout the state, particularly when it comes to the Black community?
Yeah, well, in general, I guess one of the statistics, we statistics will show that there's a heart attack roughly every 34 to 40 seconds in this country, and that's across populations. That's across the U.S. Now, in Louisiana, in the United States, there's about 680,000 deaths from cardiovascular disease in this country. And in Louisiana, it's somewhere around 12 to 13,000 deaths in our state where we lose people to cardiovascular disease. And so there's a little bit of a disproportionate impact in our communities. And, the prevalence, it's prevalent in almost half of the African American population in the state of Louisiana. And as opposed to, let's say, the white population, it's significantly less, more like 30 to 35% prevalence. But just when we look at our communities, I think it's reflective of just those things, some of those things that we're talking about, just the habits. We're a community and a state that is known for its food, its cuisine, its atmosphere. There's a Southern hospitality, and we sit at a meal and we're thinking about the next meal. I'm guilty of that myself, but that's just kind of the way that we're. And in our communities, um, I had a woman. This is a true story. A woman yesterday was visiting with me, and she's an elderly woman. I was seeing her for a chronic heart condition, and she's very, very thin. And she said, "Doc, do you think I'm too small?" And I said, "No, I don't." And she says, "My family is always telling me I'm too thin and I need to gain weight." And so we stopped there and I said, "Ma'am," and she had a granddaughter with her. And I said, "This is cultural because you know what we say, even when there's a newborn baby, what do we say? You have to fatten that baby up." And so it really starts, and that's just been, that's going back centuries where, just being thin in our culture is almost looked down upon, and that maybe even being unhealthy. And if you go around the fellas and tell them they're thin, they're bucking up and taking a breath and kind of poke the chest out, but that's a cultural thing. And so, what do? And then another patient this week says, "How can I put some weight on?" And I'm like, well, and this guy has a very weak, he's got an enlarged heart, a very weak heart. And I told him, I said, "I don't think there's a healthy way you can put significant weight on without putting yourself at risk." So, because those habits can lead to, being overweight. Overweight can put you at a higher incidence of becoming diabetic, and diabetes is a major risk factor for heart disease. And along with that goes high blood pressure, some other chronic conditions. High cholesterol. We didn't talk yet about the risk factors for developing heart disease, but those are three of the big ones: high blood pressure, high cholesterol, diabetes, are the three of the major risk factors for developing heart disease. And when you look at the habits, those things we say that they're modifiable and many times preventable just with some lifestyle changes. Some of the genetics are important also. If it runs heavily in your family, I think there is something to be said about the DNA that runs in your family, but also I think equally important are the habits that exist in families. So, I mean, if mom and dad are eating heavy every weekend, you're going to eat heavy every weekend more than likely. If what's presented to you at the dinner table is unhealthy, then that's what you're used to eating. And so I think that lifestyle is as important as the genetic transmission of any risk for heart disease.
You're listening to The Way Forward. I'm Eddie Francis, and we are talking to Dr. Lance Lamotte. He is a cardiologist based in Baton Rouge, and we're talking about taking care of our hearts and understanding how we can invest in our heart health. And one thing that I thought about as you were talking is my wife and I share food all the time. And there are people who will see us sharing food and they will think something is terribly wrong. And so I'll never forget this. I was actually at a fraternity function, and she and I were eating off the same plate. And one of the brothers looked at me and said, "Fred, what's the matter with you? You don't let your wife eat off her own plate?" And I said, "Well, no, we share food." And he was mortified. And he said, "Oh no, I gotta have my own plate." And look at you too. Look at you. You're not letting each other eat. And we're like, "Well, we are letting each other eat." But one of the reasons that we started doing that is, first of all, she doesn't eat that much. And then when I realized that it was helping me control portion sizes, I was like, well, this is actually a pretty good idea. So let's just keep doing this. Plus it was a money saver, but it was interesting, but it's interesting because every time we tell someone we share food, or every time we see or somebody sees us sharing food, it becomes a tragedy to people. And they just get into this whole "what's the matter with you two" thing.
Yeah.
Have some more food, have some more food. I've been at events where people put a piece of meat on the plate, and they'll put a little bit of green beans or something. I'm like, okay, that's enough. What's the matter with you? Oh no, baby, you got to eat. And I'm
Yeah,
going.
that's exactly
I'm
what
like,
we were speaking
no,
about.
ma'am, this is all I want.
Well, you ought to see how they look at me now, because for the past 3 years I've been mostly. I started off being vegan 3 years ago, and I probably can only say I'm vegetarian at this point. And I did slip a little piece of fish in last night at dinner,
Oh,
but
for shame.
people look at me like I'm a Martian now. And so what do you where's your protein come from? What do you do? Do you feel weak? That's a whole different discussion.
Yeah.
That's radical talk here in Louisiana. People think you're from another planet talking about not eating meat, especially here in Louisiana. But so we won't spend time on the platform pushing that too much.
Well,
But
let's talk about early detection. I mean, what are some of the signs that people should look for, that they need to take better care of their hearts?
right. Well, I would say first of all, understand the scope of the problem. The number one threat to your health and your longevity is heart disease, and the elements, the risk factors that can lead to this, you should know. There's a term, know your numbers. So you should know your blood pressure. You should know your cholesterol level. You should know your blood sugar levels if you're diabetic or predisposed to diabetes. And so knowing that you've got to keep your blood pressure preferably 120 over 80 or less is the goal. And whether that requires medications, or if just healthy lifestyle habits, that's the goal for blood pressure. If you have high cholesterol, if your cholesterol is over 200 or your bad cholesterol is over 130 or so, that needs to be addressed at a minimum with lifestyle, and many times with medications if it's significantly elevated. And blood sugar, diabetes is highly prevalent in our communities. And that you don't. Diabetes is much more prevalent in people who are overweight, but is not isolated to people who are overweight, because you can have diabetes and still not have extreme excesses of body weight. So, at a minimum, if you have those conditions, understand that you are at risk. So, that being said, people often say, when should I start seeing a cardiologist? And so there's no one answer to that. But if you are at risk, you should make sure that you're having discussions with your primary care physician about, because we have there's apps and formulas and calculators that we can actually plug your numbers in and predict your risk. And certainly if your risk is high, you should be you and your provider should be on a plan where you are aggressively treating those risk factors to decrease your risk. Now, we haven't talked about smoking. That's another major risk factor for developing heart disease. Family history is the other thing, and we did speak on that a little bit. So now, most ailments that impact the heart will manifest in one of a very few ways. The classic symptoms of pain or pressure or heaviness or tightness. And we all saw Sanford and Son when we were growing up. And, Fred Sanford was always kidding around, but he actually was illustrating a fairly realistic, presentation of a patient having a coronary event. So, classically, the pain from coronary disease or blockage in the arteries is pressure, heaviness, or tightness, usually in the center or left side of the chest. It can go to the jaw, neck, arm, or back. Those are classic symptoms. So chest pain is one thing. Losing your breath with activities that shouldn't ordinarily make you short of breath, or sudden. Some people, it's a little more subtle, where they just start to withdraw from their activities because they're having difficulty, walking through the grocery store. I hate Walmart, so I always ask, do you have shortness of breath when you walk up and down those aisles at Walmart? I said I get short of breath just because I don't like going in there, but. Because I'm always almost getting into a fight with people when I turn the corner with my basket, So, uh, but shortness of breath with activity. Other signs would be swelling in the extremities, heart racing. Classically, those are the things to be on the lookout for, and particularly, I'm speaking to the men that may be listening or watching. We tend to ignore things unless they're falling off. Most of the men that I meet in the hospital, rather than in the office. And I'd rather meet them in the office when we can get ahead of things rather than meeting in the hospital and trying to patch things. And so men, as we need to be more proactive and engaged in our health, and not just wait for things to develop. We're in a season of life. I'm in my 50s, for not much longer, but in my 50s, and things of the past start manifesting in those 40s and 50s. And I can remember Mr. Scott at St. Aug said to us, "Look around, because some of you won't be here in a few years." And at age 17 and 18, I'm like, "What are you talking about?"
That made no sense at the time.
It
Yeah.
made no sense, but you can think in your class, and I can certainly think in my class, some classmates that we have lost, and more than a few. And so, when you look at this season of life and how people are losing their lives, it many times is related to some habits that never changed over the course of their young adulthood. And so it's important to make those changes. It's not too late, but also make sure that you have a relationship with a physician who is going to see and hear you. And that's another important message, having a physician that we have a term called concordance, patient-physician concordance, someone who can understand you. And I'm not saying that, and there really aren't enough African-American physicians to go around. And I'm not saying that there aren't, majority of physicians who aren't excellent providers, but, just there are sometimes some subtleties in caring for our patients that we have when we have that connection and we understand that they may not be using the words that trigger other folk to pay attention to, but they're things that we have the ability to pick up in our culture, where we know certain signs and manifestations that others might not detect.
Mm. Yeah, look, I can definitely attest to that. I mean, I have been in a situation where I've gone to see a physician. We've had a conversation. I didn't like it, and so I went to go see someone who looked like me. Things went a little better,
Yeah.
a lot better. I can actually say now. Let's talk solutions. What can people do? Now, I know you're a big fan of boxing, but for people who want to start a little slower, who might not necessarily, who might actually have some other types of activities that they may be into, what are some of the things that people can do to actually get their physical activity going so that they can take care of their hearts?
So the American Heart Association's recommendations are 150 minutes of exercise or activity per week. And so that breaks down to about 20 to 30 minutes of activity most days of the week. And so my message to patients is not really so much what you do, it's that you do, is that you do something. And so it can start with something as simple as walking. So just walking several times a week is something that's achievable by most. And then some people obviously can't. They have orthopedic limitations, or if they've had medical issues that prohibit them from walking, and that's understandable. But for those of us who can walk, we have to be intentional. I say it takes some self examination. You have to do analysis on yourself and say, okay, am I a lone wolf? I just want to do this on my own. Or do I need a partner, an accountability partner to kind of take this journey with me? Do I need to go to a gym? Do I need to go to a class? Do I need to, you have to do an analysis. You have to find something that you're going to stay committed to. And if you need somebody to keep you accountable, then put yourself in that kind of environment. Um, we live in an era where everything is available online, so you can even sign up. There's all kinds of platforms that exist on our computers, on YouTube. You can subscribe to all kinds of activities, but the message is to do something. And if you haven't been in the habit of exercising, yes, you want to start slowly. You don't want to injure yourself. You don't want to get frustrated early in the process. But one step forward today could be two steps forward tomorrow, or you could have days and days of inactivity. So you just start somewhere, and I think that commitment is key. And so if walking's not an option, if you have access to a bicycle, either stationary bike, or a bicycle, if you can find safe places to ride. Some people are into swimming. Some people are into the sports. Pickleball's a big craze now, but you just want to make sure that that's safe and appropriate for you. I know there are a lot of injuries related to pickleball in patients, folks who've not really been used to the starting and stopping of that sport. But something is the message,
Mm.
with some regularity also.
So what about people? I'm also thinking about people who are under a lot of stress at work. I have been in a position where I've been under so much stress that I felt palpitations one day. And I just slowed down everything. I took some deep breaths. I went for a walk so that I could calm myself down. So, for people who are under a lot of stress at work, what can they do to manage?
Yeah. Stress is huge. So we all are under stress. I mean, all you have to do is turn on the news. And I used to kind of chuckle at my senior partner. He used to advise his patients not to watch the evening news, and I thought that was a little bit strange. But I have to turn it off, just because it could
Oh, I'm
it
with
could
him. Yeah.
yeah, I could it could raise your blood pressure, and stress is very real. So I think the important thing is to acknowledge it, and then figure out. I like to tell people just to tap into your place of peace, and whatever that is for the individual. So if it's a book, if it's the Bible, if it's a buddy, if it's a basketball, if it's a boxing bag, it's if you just have to punch something, don't punch somebody, but punch something. Uh, if it's cranking your radio up or turning your radio off, I think it's important to tap into that well particularly when everything is happening around you. And for me, it's just because work is I say my job. I feel like I'm stepping on a moving train every day, but I really look forward to when I'm not on call on the weekend, just really unplugging and just taking a breath, which recharges me. I go to the gym in the mornings, and that's kind of a mindless activity. I don't have to think too much. I just do it what the class instructor tells me, and that's I don't have to think about that. And for me, just doing something that doesn't involve a bunch of people pulling at my time is the way I hit reset to allow me to do my job more effectively. Because you know those of your listeners who may work in healthcare, if you ever see a bunch of doctors walking around and they're just bitter and mad and angry, because in addition to having to care for patients, sometimes physicians themselves are not good at taking care of themselves. And so I think it's a manifestation of the job stress, as they're also trying to balance, the pressures of life that impact us all. And some of them have a very difficult time in achieving that balance, and that can be it can make for doctors flying off the handle. I mean, it's so it impacts physicians as well. So mental health, mental stability is critically important, even as we talk about physical ailments like heart disease, but mental uh, you know well-being is just as important.
Yeah. And then so for the final, this is going to be the hard part for some people. Diet. What can folks do to manage their hearts when it comes to the diet?
Yeah, so you again, we're in Louisiana, and so we know. I tell you, many times meat is at the center of the meal, and kind of to the exclusion of some of the other healthier portions. And I'd say your protein sources should preferably be leaner sources of protein. So either leaner, preferably poultry, seafood. There is a push for plant-based protein eating if you can navigate that space, and it should be balanced with vegetables, whole grains, beans, nuts, fruit, vegetables, and but the fried food, the smothered food, the heavy, rich gravies and those things, can there are a lot of calories in those choices, and and usually a lot of saturated fat, which over time can accelerate hardening of the arteries, which is the number one killer. And so even acutely, that stuff can raise blood pressure and cause the blood to be a little more sticky. So just making those changes may take a family effort, and so I would challenge us to kind of look into the DASH diet, and or the Mediterranean diet, which have been associated. DASH diet, we really push for helping people control their blood pressures, and the Mediterranean diet, which again is rich in whole grains and vegetables and such, is associated with a lower incidence of cardiovascular disease in those populations.
Hmm. Hmm. Dr. Lance Lamotte, he is a cardiologist based in Baton Rouge. Hey, man, thank you so much for joining me
My
on
pleasure.
The Way Forward.
Thank you, cousin.